I'm Berks County Commissioner Christian Leinbach, and I want to welcome you to the Commissioners' meeting for January the 13th. We're broadcasting live on Microsoft Teams live event, also on BCTV, as well as Facebook and YouTube Live. At this time, I'd like to recognize my executive assistant, Anne Marie Grill. Anne Marie?
Thank you, Commissioner. Public comment will be accepted in person and through the Q&A function. Please include your first name, last name, and municipality for all comments. Any comments without name and municipality will not be considered. Each citizen can submit one comment. Comment length is dictated by limitations of the platform being used. Teams Q&A, Facebook, and YouTube. In-person comments will be accepted first, followed by comments submitted virtually. The meeting comment period is limited to a total of 30 minutes, including both in-person and virtual comments. This time period may be extended at the discretion of the board. Please be concise. Comments that are germane to county business will be read during the meeting and should not be considered to be interactive dialogue with the commissioners. The county solicitor shall be the final arbiter of whether a comment is germane and should be read. Any commissioner response to public comment will be done at the discretion of the commissioners.
Thank you very much. At this time, we'll begin the meeting with a moment of silence, followed by a pledge to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. As we do each week, we will go to our Berks County COVID-19 data report. And Brian Gottschall will be presenting. He's our director of the Berks County Department of Emergency Services, and he is also the lead on the Berks County COVID-19 leadership team. Brian Gottschall.
Good morning, Commissioners. Thank you. This week's report is going to be pretty brief because, in all honesty, there isn't a whole lot to say that's breaking news. I think a lot of what we're going to cover is already out there and known to the folks. Certainly, the star data point is our incredible case increase over the last 2 weeks, with multiple days, I think 6, in excess of 1,000 new cases a day in Berks County. That's represented by the blue line on this chart. And I'm sure folks will notice that we've stopped tracking the orange line, which is testing. This is unfortunately due to the availability of testing data that DOH is putting out there. As we're now getting more into the high transmissibility of Omicron, we're seeing many people who had previously tested negative now going back and having a new exposure related to Omicron and ultimately testing positive. This has caused a huge alteration in the way that this data is available to us, and we're now not able to accurately represent even an estimate of the amount of testing going on. So rather than show faulty data, our preference is to show no data in that regard. And moving forward, this graph will track simply cases. This was a little alarming to me. Last week, while there was a lot of red on this map, we still had a bunch of blue and yellow, and I looked at the counties and I thought, well, geez, they're just kind of small counties. They're out there and, fairly unpopulated, and we're not going to see them make the change. In reality, many of those counties now have made this change to high transmissibility, even given their low populations. And as you can see, we're down to less than 1% of the counties in the entire United States that are not considered to be in a state of high transmission of COVID-19. Our pediatric cases in Berks County have gone up quite a bit, as the graph represents, in both the 0 to 4 as well as the 5 to 18 category. As I've said each week, when you look at these increases as a proportion of the total increases in the county, I don't think that it would be fair to say that they represent a disproportionate impact on children. Again, we of course need to look at how sick are people getting. Are they being hospitalized? Are they dying? Those are all important things that unfortunately come after the case count spike. So we really can't evaluate that data yet. But with respect to case count, While these slopes are alarming and the numbers are alarming, I think we have to temper that with saying that if you compare these slopes to the slope of the overall population case count, they do look very similar and are proportionate. I will also mention that that's a little different than we're seeing at a national level and in some other regions where they are reporting a significant impact on pediatric cases, with much higher percentages being hospitalized as a result of this variant than we've seen in the past. So we continue to hope that that's not going to be the case around here, but it is all a story that is yet to be told. Our hospitals are, again, extremely busy. This is just a recurring message that we have week over week. And while certainly COVID is not the sole reason that our hospitals are under such stress, it is a contributing factor, but we need the populace to help with all of the factors that contribute to stress on our hospitals, whether it's COVID, influenza, the use of inappropriate levels of medical care for other medical needs, or just in general, how we go about treating our healthcare providers and not taking our angst or frustrations out on them, because they really don't need that right now. And that's something that certainly all of us can do. No matter how we feel about vaccines or how we feel about mitigation, we can try to be a little bit more kind to each other. I don't think anybody would argue that that has a political or non-scientific slant. Probably the biggest bright spot of good news in our report this week is with respect to our influenza numbers. As you can see in the red line, our cases over the last week have dropped dramatically. We, of course, will hope that is kind of a representation, almost like the blue line there that shows the 2014-2015 year, where we saw a very harsh peak and then a rapid drop off that continued throughout the remainder of the season. This is what we hope to see. We see in the gray line there, representative of 1920. We do sometimes have drop-offs that then result in upward spikes again. So again, a story yet to be told. Actions that folks are taking to mitigate against COVID are the same actions that they can take to mitigate against influenza. So you really get a double dip for anything you're willing to do in that regard. On the current event stuff, just want to reemphasize the availability of the COVID testing site here outside of DES and 2561 Burnville Road, Thursday through Friday from 10 a.m. to 7 p.m., Saturdays from 9 a.m. to 3 p.m. This will now continue through the 28th of January, thanks to the commitment of DOH to continue supporting this operation. I do want to emphasize that there is a maximum of 450 tests a day. So even though we advertise a closing time, if we hit that maximum number of tests, we unfortunately have to close early. And I also want to bring to the public's attention that turnaround times have become very protracted across the entire Commonwealth and the nation in general, to be honest with you. These tests all are being aggregated at the State Department of Health lab from Pennsylvania. And while we had been able to advertise a 72-hour turnaround time, and in fact, we were doing much better than that in many cases, we've now been asked to push that out to 96 hours due to the fact that both the laboratory and the notification center are just overwhelmed with the volume of testing. I will mention that the testing volume in the last couple days has been down, and as compared to the prior week where we were maxing out every single day. I don't know whether that's good news and that it's indicative of the fact that we've maybe tipped over a peak here of testing demand in the community, or whether it's bad news and that people have just started becoming less interested and aren't even worrying about getting tested and confirming their status. But hopefully that decrease in volume will be representative of a return back to better turnaround times on the tests. And as we've emphasized each week, please, if you do come to the test site, enter following this red arrow on the map off of Van Reed Road, and please do not queue out onto the public roadway. We have flaggers here that will prevent you from doing that and ask you to please return at a later time if we need to maintain public safety on the roadway. As always, we would emphasize that folks should go to doyourpartberks.com, where they can find most current information on all these topics, including testing. And Steph's been doing a great job as we provide, every other hour updates from the test site about turnaround, about delays and line times and stuff like that. Steph does a great job of also getting that updated on doyourpartberks.com. That's it for me, Commissioner. Back to you unless there are any questions.
Thank you very much, Brian. Are there any questions for Brian?
No questions for me. I just want to reiterate something that Brian said, which is to please be kind to others, especially if you need to go to a hospital, a doctor's office, or an emergency center. Please be patient and please be kind to those that are there as well. So thank you for that, Brian.
Absolutely. Very good advice. And you know what? Being kind doesn't cost us a thing. Okay, we'll move on with our agenda. Are there any additions or corrections for the January 6th Commissioner meeting minutes? Hearing none, the minutes will stand approved as presented. We did have an executive session yesterday, January the 12th, dealing with personnel and litigation. Anne Marie, is there any public comment on specific agenda items?
No, there are no comments at this time.
Thank you. Item 1, authorizing under that Budget Department, adopt a resolution authorizing 2021 budget transfers in the amount of $423,630 and 2022 transfers in the amount of $13,338, 2021 appropriations in the amount of $203,086, and 2022 appropriations in the negative amount of $189,262 per listing dated January the 7th of 2022. We have one item under Human Resources, authorize the promotion of Carmen Colazo Rosario from Human Resources Generalist to Human Resources Generalist / Trainer in Human Resources. I have several items listed under my name. Item A, adopt a resolution authorizing the reappointment of Courtney Dillard, Wyomissing, PA, to the Council on Chemical Abuse Board of Directors for a 3-year term expiring on February 1st of 2025. Excuse me a second. Item B, adopt a resolution authorizing the reappointment of Josephine Torres Boykins, Reading, PA, to the Council on Chemical Abuse Board of Directors for a 3-year term expiring on February 1st of 2025. And then item C, adopt a resolution authorizing the reappointment of Kelly Culp, Birdsboro, Pennsylvania, to the Berks County Mental Health and Developmental Disabilities Advisory Board for a 3-year term expiring on December 31st of 2024. We have one item listed under Commissioner Rivera, adopt a resolution authorizing the appointment of Raymond Blydenberg, Mooresville, Pennsylvania, to the Reading Regional Airport Authority for a 5-year term expiring on December 31st of 2026. There are several items listed under the Commissioners. Item A, adopt a resolution authorizing execution of the agreement between the County of Berks and Community Care Behavioral Health Organization, and this is effective January the 1st of 2022 through December 31st of 2023. Item B, adopt a resolution authorizing a letter of support on behalf of the Armed Forces Brotherhood with respect to their grant application to the PA Veterans Trust Fund for funding to assist with emergency housing assistance to veterans and their families. Item 2, a motion to authorize execution of contract agreements and amendments as set forth on the attached listing dated January the 10th of 2022. There are a total of 15 contracts. There's one with the Area Agency on Aging. There's one jointly between the Area Agency on Aging and the solicitor. There are two with Children and Youth Services, 2 with Berks Connection Pretrial Services, 1 with the Department of Emergency Services, 1 with Facilities, 3 with the Berks County Jail, 1 with Parks and Rec, and 3 with Human Resources. Item 3, a motion to authorize execution of the payments and electronic transfers is set forth on the Controller's Office voucher listing dated January the 13th of 2022. And item 4, a motion to authorize execution of employee payroll disbursements dated January the 18th of 2022.
Motion to approve the agenda as presented.
Second.
The motion has been made and seconded. Is there any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? The motion is carried. We'll turn now to our Berks County Treasurer, Dennis Adams, with the Treasurer's Report.
Good morning.
Good morning.
We have an opening balance today of $170,048,682.06. A balance to clear of $5,653,314.32, leaving us with a balance today of $164,395,267.74.
Thank you very much, Dennis. We will now go to our County Controller's Report, and we have Grozna in to present the Controller's Report. Grozna?
Good morning, Commissioners.
Good morning.
Total cash disbursements for the week of January 13, 2022 were $7,120,419.58, which comprised of several various different checks and wires. And there was no payroll process for this week.
Thank you very much. We'll move now to our Chief Administrative Officer, Ron Seaman. Ron?
Thank you, Commissioner Leinbach. I have nothing to report at this time.
Thank you very much. We'll move now to Commissioners' Reports, and we will begin with Commissioner Michael Rivera.
Thank you, Commissioner Leinbach. Just a few things here. First of all, want to welcome John Fielding, our new coroner. I see he's on the call today. So, John, welcome. Looking forward to working with you in your new role now, and congratulations.
Thank you.
Also, absolutely. Also want to welcome Ray to the Reading Regional Airport Authority Board. I had the opportunity to speak with Ray and nominate him, and I feel he will be a good fit to continue moving the airport forward. So Ray, welcome, and thank you for agreeing to serve on that board. One other thing I just want to add, there will be the Pennsylvania Homeowner Assistance Fund will open on February 1st. I had spoken about this a couple months ago when we were talking about ERAP, which was the assistance for renters. The Homeowner Assistance Fund is assistance for homeowners who have been negatively impacted by COVID. Pennsylvania has $350 million that is set aside for this. That's for the whole state. So if you look at it, it's a large amount, but it's really not that big for all the need that we have been seeing out there. There are certain guidelines that you have to qualify for to be able to apply for this program. And to a certain extent, it is a first come, first served program. So you want to make sure that if you do need assistance with your mortgage payment to prevent foreclosure, that you get the application in as soon as possible. For more information, you can visit www.pahaf.org. Again, that's www.pahaf.org. Or you can call them. There's a number for them as well. Or go to the website for all the information there. There is also a list there of how you can apply. And there are certain organizations that will be helping with that process as well. That list is on there also, as well as a full list of the eligibility requirements. So if you or anyone you know has been negatively impacted by COVID and has been having problems paying your mortgage and maybe be foreclosed on, please go to, again, pahaf.org. Do it now. That way you can go preparing what you need to apply. That's all I have. Commissioner Leinbach, back to you.
Thank you very much, Commissioner Rivera, and we'll move now to Commissioner Kevin Barnhart.
Thank you, Commissioner Lineback. I have nothing to report at this time other than welcoming John Fielding to the county team.
Thank you very much, Commissioner. Just two items. I also want to welcome John Fielding to the team. I was talking to him a little bit right before we went live that I let him know I was glad he decided to join us. We have several of the row officers that pretty consistently join the commissioners meeting each week. So John, welcome. I just want to note, I want to take this opportunity to highlight, and I'm going to share my screen. This coming Monday is Martin Luther King Day. And as you think about that, and I'm going to try to share my screen. I don't know. We'll see if it comes up. Can you see that image?
Yes.
Okay. One, probably the most famous quote from Martin Luther King is, "I have a dream that my 4 children will one day live in a nation where they will not be judged by the color of their skin, but by the content of their character." There's 2 things that I just want to highlight. Number one, I agree with Martin Luther King 100%. And I think today we spend too much time carving out special groups instead of understanding we are human beings, instead of hearkening back to the birth certificate of our country, which says all men, and the context there is all human beings are created equal, and they are endowed by their creator with certain unalienable rights, that among these rights are life, liberty, and the pursuit of happiness. Martin Luther King was right. There is no place for dividing people by ethnicity, dividing people by religion, dividing people by party, dividing people by status in society or education levels. We really need to get back to the core of we have a responsibility to love our neighbor. When Christ was asked in the New Testament the 2 greatest commandments, he said, love God and love your neighbor. I just think in the world we live in and the country we live in, we not only judge people by things that shouldn't matter, we also tend, and this has been referred to be extremely uncivil, and that's putting it mildly. We need to also follow the Martin Luther King's belief in non-violence. We can stand up, we can vote, we can speak out. We have the freedom of speech to stand for what we believe in, to stand against those things that we believe are wrong. But I would beg people not to resort to violence. I don't care where you are on an issue. Violence doesn't solve anything. It simply makes the situation worse. Hating each other doesn't solve anything. When we hate each other, we're actually hurting ourselves as well as others. So Monday, January the 17th, a Martin Luther King Day, I hope you'll think about this quote. I hope you'll think about its connection to the Declaration of Independence and the declaration that all people are created equal. Let's start treating people and as our neighbors and loving our neighbors. I'm going to close out, bring it back, and open it up to any of our row officers. And I'm give you an opportunity, John, since this is I think your first commissioners meeting that you've been on. You're new in the office. You want to share anything?
No, just that I'm still acquainting myself with all of the paper flow in here of all of the accountability. As you can see that Deb Detweiler was the one who provided the COVID report. And just rearranging the management of the office. Everything was apparently done by my predecessor, and I've been shifting decision-making downhill to get things closer to the people that are actually doing the work. And I've been helped in that endeavor by George Holmes, who's turning out to be a very adequate chief deputy. So far, so good.
Well, thank you very much, John. Any other comments from other row officers?
Good morning, Commissioner Linebaugh. It's Mary Kozak from the Rod office. I have some exciting news with the new year brings new additions, and our website has a new addition. If you go to for people to go on, they would come onto the county website. Under the website, they would look for elected officers, go to Recorder of Deeds. We now have our real estate transactions posted, and we started posting them on December 19th. Each week we will post a new posting on a Tuesday, and we will keep 4 weeks of transactions posted at all times. So since we just started it, there are only 3 weeks. Next week will be our 4th week. So I just wanted to let you and all our constituents out there know that we here in the Rod office are in helping them in any way we can. If there are any questions, they can always reach out to us.
Thank you very much, Mary, and I can vouch that the information is there. While you were talking, I went onto the website, and it's right there on
It's right on the first page.
Right-hand side, partway down, and the last 3 weeks of records are there as a link. So glad.
And I can't say that I couldn't have done that without the help of our IS department. Justin Luce, Tim Smith, Heather Berger, Lori Schneider have been there for every question I had. And they were there with me every step of the way. So it just goes to prove you can't do one thing, you can't do anything without the help of someone else. So I am eternally grateful to them.
Absolutely. This program, if it wasn't for IS, we'd be meeting in person or not at all. They do a great job. So thank you for the shout out to the folks at IS.
Sure thing. Thank you.
Anyone else? Okay, at this time, Anne Marie, are there any public comments?
No, there are not.
No public comment. Anything else for the good of the order?
Motion to adjourn.
Second.
The meeting stands adjourned.